Hello, we are the Association for Child and Adolescent Mental Health, or ACAM for short.
Hi, I'm Helen Minnis.
Hello, I am Alessandro Vinciarelli.
And we're here to talk about our new paper in Child and Adolescent Mental Health called The Use and Potential of Artificial Intelligence for Supporting Clinical Observation of Child Behaviour. And Alessandro introduced me to the whole concept of artificial intelligence. I'm a child and adolescent psychiatrist, and I was attracted by the idea that, if I remember rightly, Alessandro, you always said that it was a way for the computer to take over the boring, repetitive tasks from the clinician, which sounded good to me, and freeing the clinician up to make the clinical decisions that only a human really can make. So how does artificial intelligence work in this context?
So, artificial intelligence lends itself very well, its application lends itself very well to psychiatry, because a lot of the psychiatric work is about observing the behavior of the patient. And the behavior is something that we can see, we can hear, it's accessible to our senses, which means that it is accessible potentially to normal sensors like microphones, cameras. Mm-hmm. And once you have that data, then you can analyze it, extract information from it, and artificial intelligence can automatically map it into the judgment of clinicians. Mm-hmm. So as a matter of fact, artificial intelligence can be too often as a kind of statistical bridge between the observations that we can make about behavior, facial expressions, tone of voice, gestures, movements, etc., and the judgment of clinicians that can say something about the condition of a child, right? And that's how artificial intelligence can really work very well in this context. Mm-hmm.
Mm-hmm. Yeah, I mean, it was fascinating for me because we used it to create a rating system for an attachment measure, didn't we? I had worked for years with the Manchester Child Attachment Story Task, which is one of the, it's a well-validated measure of attachment in children aged 4 to about the age of 8 or 9. But the problem is it's really laborious to train and to rate. And so what we did was we turned it into a computer game, a simple computer game where the computer told the beginning of a story, an attachment-related story, with a stress in it. So, for example, something like Alessandro doll is out playing in the garden with mummy doll, playing football, and suddenly he falls and he hurts his knee. So you create a bit of stress, and then you hand the dolls to the child and you say, show me and tell me what happens next. So with our colleague Stephen Brewster, he developed a lovely system where there were tangible dolls with movement sensors. And if I remember rightly, it was the algorithm that you developed to rate each child's task was based on the hand movements. And so for me, that was mainly based on hand movements. And what was fascinating for me was that was proximity seeking between mummy doll and child doll. Have I got that right, Alessandro?
Yes, that is exactly the point of artificial intelligence. We know that the inner conditions of children, in this case it was secure or insecure attachment, leaves physical, detectable traces in the behavior of the child. In this particular case, it was the attempt to get physical proximity between mommy doll and child doll. And that can be detected, that can be measured, right? It's something that corresponds to a physically measurable trace in the data. And that is exactly what artificial intelligence is about. If there is a physical trace that accounts for the condition you are interested to detect, then it is possible to fundamentally map the measurements that account for that condition into the judgment of the clinicians. And we started with gestures because there was this very high-level semantic information of the physical proximity, but then we transfer more or less the same approach to a lot of other traces that are maybe less semantic, but still very much important, like prosody, like the tone of voice, like the lexical choices, etc., and combine all of them together, right? And that allowed us actually to detect with a good performance, potentially insecure children, right? And to do it, by the way, in a fast way, without intervention of, without manual intervention of operators, medical doctors, etc. So the interesting thing is that you can reduce the burden for doctors. You cannot replace doctors because the decision ultimately has to be made by a human, but at least the easy cases can be detected and processed automatically, right? And it will be quite a step forward because, you know, now it's a lot of time, so only a limited number of children get actually analyzed and observed in terms of attachment, right? So it will be a major step forward, automation, because it allowed a large scale screening of the population.
I mean, I think for me, that's the big thing because, you know, attachment theory has been so important in research, but it just hasn't quite translated into clinical practice. So I think it does give us some real opportunities. But I think one of the problems is that often as clinicians, we're quite concerned about the ethics of AI. So I don't know if you have any comments on that.
Absolutely. So it is very much important to assess the potential harm that can come from the application of this. And in particular, AI in itself, it doesn't have intelligence, it doesn't have ethics. The point is to monitor the application and make sure, first of all, that in the human judgments that were used to train the artificial intelligence, because artificial intelligence learns from examples that are provided. So in this case, it learns from clinicians that provide judgments about a certain number of children. So it's important to ensure, for example, that there is no bias. And it is something that we measure on our data to make sure that there was no bias related to age or to gender in particular, right? So this is something that can be somewhat measured. And very important, it is important from the side of the clinicians that use these technologies not to over-rely, not to take the outcome of these technologies without critical thinking. So in a sense, it will be important that clinicians, but in general users of artificial intelligence, develop a kind of theory of mind about the artificial intelligence, right? They try to make sense of the decision.
Yes.
And in most cases, actually, just to confirm and say, yes, the decision makes sense, but always keep a little bit of of attention and care, not to over-rely, not to accept critically whatever the outcome is, right? Because these technologies make mistakes. Right?
Yes. And I guess that's the same as any tool that we use in child mental health. And in fact, any tool that we use in health, you know, that we just, you know, we don't allow it to take away from our own critical thinking. And we realise that it's not a human and that it has its limits and it has its biases. So, you know, from that point of view, I personally see huge potential in particularly in child mental health with younger children. I'm really interested in infant mental health. And of course, babies and very young children, they can't tell us exactly how they're feeling, and their behaviour is often symptomatic of how they're feeling. So anything that can actually help us to be objective about that, I think has huge potential, as long as we keep that critical thinking.
Yes, absolutely. Yes, yes.
And I think that's probably a good way to end.
Yeah, AI, it is something that can help to increase efficiency, but it is certainly not something that can help to increase effectiveness. So it's important not to develop the illusion that it can work better than a doctor, right? It can make the doctors faster. It can make the doctors more efficient. It can reduce the time dedicated to the more tedious and repetitive parts of the job. But ultimately, it is always the doctor that makes the diagnosis. Right?
So the psychologist or the speech and language therapist. It's absolutely, it's up to us humans with our professional expertise to make the decisions in the end. But this could be a really important tool. Thank you so much.
Thanks to you.
Find out more about becoming an ACAM member And to be part of the advancement of child and adolescent mental health, visit www.acamh.org.